I'm gonna knock into the room. Hi, my name's Brooke. I'm gonna be your nurse today. Your doctor has an order to insert an IV and start some medications, so I'm gonna be doing that. Can you tell me your name and date of birth? And I'm gonna check their armband to verify their name and date of birth. Do you have any allergies? My patient has no allergies. I'm gonna provide for privacy, and I'm gonna wash my hands. So, before coming in the room, I've gathered all my supplies and I've prepared my medication. I've checked my MAR 3 times. When the order came through, when I'm preparing the medication in the med room, and then at the bedside before I give it. And I'm checking my medication for the 6 rights of medication administration. So I've had the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. So I'm going to grab my medication, and I'm also going to, if I'm using a pump, I would scan my medication, scan my patient's armband, and scan the pump as well. And then I'm going to get my IV tubing out, and this would have a cap on the end. I'm going to clamp my tubing. I would pull this, and then I'm going to pull the end off of the bag, and I'm going to, without touching either end, I'm just going to spike my bag. I'm going to hang it and squeeze the chamber about halfway. I'm going to unclamp that and prime my tubing. Once I have that primed, I'm going to hang that up, and then I'm going to label my tubing with my name, the date, and the time that I got this tubing out and attached it. And if I was going to be using a pump, I would go ahead and set the pump up with the medication and the ordered rate and dosage of it. Then I'm going to start for my IV. So I've checked my orders. I made sure I had an order for the IV, and I made sure that I have the right gauge that I need for what fluids they're going to be getting, and everything is good to go. So I'm going to wash my hands again, and I'm going to prepare all of my things. So I'm just going to get my Tegaderm out. And then I'm going to grab my J-loop, and I'm going to grab an alcohol swab. And I'm going to wipe off the end of the J-loop. And then I'm going to grab a flush. And I'm just going to attach that and flush that. Okay, once I have that flush, I'm just going to put it back in the packaging, leaving that attached. And then I'm going to put on gloves. Alright, I'm going to take my chlorhexidine, break that, and then I'm going to, first I'm going to apply this tourniquet to my patient's arm, and I'm going to palpate for a vein. Once I've selected the area that I am going to use, I'm going to take my chlorhexidine, I would break that, and I'm going to rub the area for about 30 seconds to get it nice and clean, and then I'm going to wait for that to dry. I'm going to get my IV catheter ready. I'm using a 24 gauge, so I would document the size of the catheter that I used, where I put the catheter in my patient, if there were any complications, how many times it took me to get the IV, and how my patient reacted. So once my site is dry, I'm just going to make sure I'm using bevel up, and I'm going to hold the skin taut about 1 to 2 inches below where I cleaned. And I'm going to insert at about a 15-degree angle. Once I get flashback, I'm going to advance my catheter. And then I'm going to hold pressure throw away my needle, pop my tourniquet, and then I'm just going to attach my J-loop. And then I'm just going to stabilize that. I'm going to pull back to make sure I have blood return, and then I'm going to flush. Okay, and once I verify that that works, I'm just going to take the flush off the end of my J-loop. I'm going to grab my tourniquet, or my tegaderm. And stabilize my IV. Once I have that stabilized, I'm going to take some tape. And I'm going to anchor my J-loop. Then I'm going to take another alcohol swab and swab my J-loop again. And then I'm just going to take my tubing, attach that, unclamp this, or if I was using a pump, I would just start the pump. And I'm going to stay with my patient for a few minutes, make sure that they're not having adverse reactions from it. And I'm going to document the size of the catheter, the site, where I put it, how many sticks, any complications, anything like that. I'm going to clean up my area. And now I'm just going to and then I'm going to take my gloves off, wash my hands. I'm going to come back over to the patient, make sure they're comfortable. I'm going to give them their call light, make sure their bed is lowered and locked, their side rails are down, they don't need anything, and I'm going to report and report.